Hello, I'm Dr. Samir Aire. I'm a board certified cosmetic and plastic surgeon. I do practice in Mumbai and Goa. Welcome to our channel, which is Evolve Cosmetic. And today I'll be taking your questions on tummy tuck surgery. So many of my patients have a lot of queries regarding tummy tuck surgery. So I'll try to address those questions in today's video. The first thing which is most commonly asked is what all problems do tummy tuck surgery address? So there are a lot of issues which are taken care by tummy tuck surgery. So tummy tuck surgery can address many issues. Women who experiences lot of problems in their abdominal area after pregnancy or after massive weight loss, this can be taken care with tummy tuck surgery. The problems to be specific which are addressed are excess of skin in the lower tummy area, weakening of the muscles, and stretch mark which are present over the abdomen. So these all areas are addressed quite well with the tummy tuck surgery. At what age should you ideally get a tummy tuck done? My personal experience is I have done tummy tuck surgery for men and women of all ages. I have done it for 18 years. I have done it for 70-year-old. So age is not a factor on which you should decide whether to do a tummy tuck surgery or not. Usually, in males, young men or maybe middle age who have done good amount of gymming, have lost weight, they do tummy tuck surgery to get a well toned abdomen, while in females it's completely opposite. Most of the women who do tummy tuck surgery are usually in their mid 30s, and they do it once they have completed their family, they have completed childbirth, and then they look for a tummy tuck surgery. The next frequently asked question is, will all of my stretch marks will go with the tummy tuck surgery? So this is a very important question and very commonly asked question. The answer to this is it depends exactly in which area you are having stretch mark. If you are having maximum stretch mark between your navel and your bikini line, then all the stretch mark are going to go. Whatever stretch mark you are having above your navel, they are going to be less visible because we are going to pull your skin down, and because of the pulling, because of the stretching, whatever stretch mark you are having above your navel will be pulled down, stretch, and will become less visible. What is mini tuck? Usually what we say is, I say in a particular way, mini tuck is a modification of tummy tuck in which we do a liposuction of abdomen and we remove less amount or little bit of excess skin from the lower tummy area. So this is what mini tucking. There are two basic differences between a tummy tuck and a mini tuck. The first thing is, in mini tuck we don't tighten your rectus muscle to that extent what we do in a normal tummy tuck. And second thing is, your navel position is not changed, or we don't reposition your navel to a new this thing in a mini tuck. So these are the basic two differences between a mini tuck and a tummy tuck. The next question asked is, what is mommy's makeover? I'll like to tell you, mommy's makeover is a treat for those ladies who have finished their childbirth and have completed their family. So what we do in mommy's makeover, so we do some surgeries for the tummy areas, like we do a mini tuck or a tummy tuck. Second thing what we do is we do some surgeries for breast because of pregnancy, because of breastfeeding. Breast usually might lose volume, or they might become saggy, or you can have a huge breast. So we can offer them breast augmentation with silicone implants. We can do a breast lift for them or a breast reduction for them. Third thing comes here is the liposuction. Usually we do liposuction of the lower back, inner thighs area, buttock area. So this can be combined during your mommy's makeover. And the fourth comes your genital surgery. If you had a normal delivery, then your vagina is lax, we do kind of a vaginal tightening or a vaginal rejuvenation surgery for them. How long is the recovery after tummy tuck surgery? Recovery after tummy tuck surgery is difficult. I don't want to sugarcoat the experience for you, but then you have to understand one thing: there is lot of investment from the patient side during the recovery of tummy tuck. Uh, Usually for first 2 days, patients need assistance to go to the bathroom. They even need an assistance to they'll have to ask somebody to serve their food and help them with their food. Next stage comes is between 2 to 5 days, in which they are more comfortable. They are able to move around the house without much assistance. They are able to cook light meals also. After 5 to 7 days, or from day 5th to day 10th, this is the first time when patient gets out of their house. So it's a very important and critical step in the recovery, because it gives them a confidence. They'll be able to go out, they'll be able to manage themselves. They come out of their house for the first time to visit me, in which I get rid of their drain. I do change their dressing also. Usually after 3 to 4 weeks, I do permit them to start physical exercise. They can even start workout in a gradual manner. And finally, can the problem come back? So if you are going to maintain your weight in a healthy range, then you are not going to again going to get this kind of tummy. Even if you are not following the diet to that extent, for you to have this kind of tummy will take another few years. So if you maintain a normal weight, then don't expect your problem to come back. But then if you are not going to follow any advices, then it's going to be difficult for you. So finally, if you have liked this video, please come to your channel, subscribe our channel, and we'll be more than happy to help you out with your more questions regarding dermatology surgery.